each other this way. Yeah, this should be pretty good right there. Okay, all right, Mary, sorry, let's go ahead and get into orthopedic exams. So first thing I'm gonna have you do, scoot back just a tiny bit for me. There we go, and I'm gonna move out of your way here. I want, let's have your feet come together. Beautiful. And then I want you to just fold over into forward spinal flexion. Let's just take a quick look there. That looks awesome. Wonderful. How does that feel on the spine and on the rest of your body? Good. Awesome. Come back up. I just do a very quick screen of just motion wise. Go ahead and lift arms overhead. Let's go into spinal extension. Let's see what we get here. So I'm going to have you lean backwards this way. There we go. Back down, arms down by your side. Beautiful. And then let's have you do side bending. Okay. So lateral flexion, you've got it. Just like that, come back up, other way. Nice, you're even there. Let's do rotation. So we're gonna get obviously more thoracic spine. Go ahead and turn. Oh, hold on, I was walking the wrong side. There we go, and then other way. Nice, good. You look beautiful. Your spine looks great. Just general motion speaking, you're very symmetrical, which looks awesome. Okay, so, okay, let's do this. Let me have you sit on the table. I'm gonna lift you up just a little bit here. Thanks. All right, I'm going to look a little more at hips here. Okay. So let's have you scoot back a little more so that, there we go, right there. So that thighs are fully supported by, okay, so first things first, we're gonna start on your right leg. Let's go into internal rotation. So we're gonna, relax the leg for just a second. Let me move you here. Okay. And then you actively swing into internal rotation. Okay, good. And then let's do, I'll take you into internal rotation. You got a little more on that side, looks like. And then swing that way, please. Yeah, okay.
So you're looking at the hips, right?
Exactly, exactly. So even though it looks opposite, even though the feet are swinging out, of course, the hips are rotating inwards. So yeah. So let me look again here. So yeah, this side definitely has less motion. So right side, less internal rotation. I'll make a little note of that to jot that down later. Let's look at the other way. So I know it's kind of an awkward position, but let's check external rotation. So let's go this way first, and then back down. Let's do this one next. Okay, let's go actively. So actually, let me have you open up your thighs just a little. There we go. And then actively externally rotate there. Good. Actively externally rotate here. I almost feel like you've got less internal here and then less external here. Yeah. So yeah, there's a little bit of an imbalance there, but that's, I mean, I see that all the time in the clinic. So the reason why I like to check hips is because if there is any tightness in the hip joint, that can affect the pelvic floor because of obviously the connection between the pelvis acetabulum, the femur, or the femurs, I should say, and the pelvic floor muscles. And of course, what's really interesting too is that there is a hip muscle, a deep rotator, the obturator internus, that can be assessed vaginally. And sometimes when people have deep nagging hip pain that they just can't get to go away, sometimes they really benefit from seeing a pelvic floor therapist, because when we do our assessment, we can find that muscle, and oftentimes people will be like, oh my gosh, yeah, that's the spot.
Well, that's interesting you say that, because this hip has been bothering me for weeks, and when I get adjusted, it feels better, but it's kind of coming back. So interesting.
Gotcha. Okay, so far, I'm just repeating it so I can remember. So far, less internal here, less external here. Let's look at strength. So I'm gonna have you come in this way. Let's go into internal again. So go ahead and slide out. Yep, hold that right there for me, Mary. Sorry, don't let me push you in. That's a tough one, I know. Hold right there, hold. Yeah, okay, let's do this one. This one will be in neutral. Good, hold right there. Ooh, that one's less too. You feel the difference there? Yeah. So I know this is going to be a weird position, but let's do external on this side. Right there. Hold, please. That's a lot stronger. Let's do this one. Hold. I would say, if I were to give you my professional opinion, this hip in general, I know that's the one that's bothering you, it's definitely weaker just for internal and external rotation. So the deep hip rotators are weaker on this side. So that might also be part of potentially why some of that discomfort is there too.
Just a question too. We're not talking about adduction.
Correct.
So when I go to the Planet Fitness and I do these exercises, that's not necessarily the muscles that we're talking about.
Correct.
Okay.
Yes. so the muscles that we're talking about are more adductor muscles, do a little bit of internal rotation, deep hip, so the gemelli muscles, the obturator internus, obturator externus, those are all the deep hip rotators there. So, and glute minimus also actually does internal rotation as well. So, yeah, and I can definitely show you a couple exercises specifically for that can be helpful for you. So, let's look at hip flexion. So, I want you to drive this knee, you'll sit up really nice and tall here, good, and then you'll drive this thigh off the table. Good, hold that right there, please. Okay. Do this one, hold. So this one felt a little stronger than this one actually, so relax here. Let's do this one more time. We'll do both sides one more time. Yeah, that one definitely, and then this one. Yeah, definitely stronger. So, I may have to write this down so I remember. But okay, so flexion weaker on this side actually. Flexion stronger on this side. So I'm gonna just write this down just so I have it all in my notes here. So we said that let's see, internal rotation on the right was less motion, but external rotation on the left was less motion. And then we found for strength, internal rotation, what I think they were I'm trying to see now.
That's it.
Yeah. Anyways, I know for a fact that the left side was weaker for the rotators. That's right. So internal and external on the left for strength was definitely weaker, but for flexion, the left leg was stronger. Stronger, and then the right was weaker.
And just for those of you watching too, when she's doing this and I'm feeling like I can literally feel the weakness. So it's really making me aware for a person who works out a lot, like, and you know, there's some not problems, but challenges here, right?
Yep, and it's just, you know what, honestly, Mary Star, what's a really interesting point is that, you know, I work with sometimes CrossFit athletes that are lifting hundreds of pounds, and I remember this one, she's a friend of mine now, but this one patient I worked with, I mean, she was like deadlifting, squatting, clean jerking, all the things. And when I tested these muscles, these deep hip rotators, she was unbelievably weak, and she was shocked herself. Like, what? How am I so weak here? And it's because oftentimes in typical programming, especially, I mean, even if we're thinking like CrossFit style or even group fitness, or even sometimes just like our own regular programming, we tend to focus on the major muscle groups, right? So quads, hamstrings, glutes, but we're not focusing oftentimes as much on the deep stabilizing muscles or the deep accessory muscles that we need, like our, you were mentioning the adduction and the abduction. That's good that you do that, because a lot of people even skip those, but even further, the rotators of the hips are super important, you know, working on the deep core connection, all those things are really important too.
So I'm excited to learn.
All right, let's look at a couple other things. So I'm gonna have you lay it down for me. Sorry, that's just me after I clean this off. Okay, I'm gonna tilt this just a little bit here so we can catch this video. Awesome. Okay, friend. So let's look at a few things here. Let's start off, your left hip's been bothering you. Okay. Also curious, Mary Star, do you, with intimacy, do you ever feel like it's worse one side or the other, or is it just kind of the whole thing is uncomfortable with the deep movement?
I mean, this hip will pinch and stuff like that too, but I haven't noticed.
Not sure. Okay, no worries. Let's look at a couple things here. So I'm gonna take your leg. I'm gonna bring you first into a little bit of flexion. So let's see. Is that pinchy at all?
No.
Okay, you let me know if I need to stop, okay? Okay, let's twist you into external. How's external?
Right.
Good. How's internal?
Fine.
Okay, good. That feels okay?
Yeah.
Okay, awesome. Let's cross this ankle over the knee and then drop the knee down. Arms up. Yeah, there we go. And then let's go this way. Awesome.
It honestly feels like a good stretch.
Good. Awesome. Let's go ahead and. Okay, this one feels a little tighter.
Yeah. I feel that.
You feel that? Yeah. That's like way more resistance there. Okay, let's check external. That one moves really well. Let's check internal. You okay there?
Mm-hmm.
Okay. Let's cross this ankle over the thigh and drop that knee down. That cause any pain?
No.
Good. Let's come into a little bit of Faber and then fader. That doesn't feel good?
Well, that's just a good stride, right?
Okay, and then relax.
Medius maybe, I don't know.
Let's go ahead and look a little more at strength. So I'm gonna have you start off with laying on your left side, lay towards me, please.
Okay.
Let's bend the knees. Good. I'm gonna come behind you. What I'd like you to do is keep those ankles close. Give me a clamshell. So, oh, sorry, you're gonna keep it up at the top. My bad, I forgot to tell you. Hold right there, do not let me push you down. So push against me. Okay, that's pretty good. Now let's try it a different way.
Okay.
So you're gonna straighten out the top leg.
Okay.
Rock a little forward. There we go. Extend your hip. Hold that right there.
Okay.
Hold it, hold it, hold it. Don't let me push you down.
Why is Pilates coming into my...
Hold again.
Ooh.
Okay, and then relax. Does that cause any hip pain?
No.
Okay, flip over for me, please. Let's do the other side. So those muscles are the glute medius. Those are the hip abductor muscles, and those are not bad. So that's pretty good. So let's stack the feet right on top of each other. I'll lift up the knee. Hold right there. Nice. All right, let's straighten out. You're gonna roll a little forward and extend the hip. Glute med here and hold. So this side's a little less though. Yeah, does that hurt?
I felt it right.
You did.
Yeah.
Okay, yeah. So this side, left side, glute medius, is a little weaker than the right side.
Okay.
Okay.
Good to know.
Let's go on your back for a second.
Okay. I think